Glad to have you back. If you're just joining us, you're watching the conversation right here on Lagos Television. Now, according to World Health Organization, the ratio to about 10,000 doctors ought to be 23 doctors. But in Nigeria, we have like 1 to 10,000 and more, if not even more. It's alarming considering that we have the Japa syndrome, where we have other countries who really do have the resources to take care of doctors are saying, please come over. We have facilities, we have modern equipment, we have the people as well to help that you need to treat. So come, we need your expertise. Now, on the part of the federal government, we have infrastructure challenge whereby we don't have enough hospitals, we don't have equipment, and we don't even have money to pay them. Some of the facilities or the hospitals are in decrepit. The situation is so alarming considering the number of people that ought to have been treated. They die by virtue of we don't have doctors around. How do we address this doctor-patient ratio? That's the conversation today. We have a medical doctor right here in the studio with us. He's the National First Vice President, Nigerian Medical Association. So he's the right person to speak to this, Dr. Benjamin Olowo-Jebutu. Did I get that right?
Olowo-Jebutu.
Yeah.
You got it right.
It's a pleasure to have you join us in the
Thanks,
studio today.
Pleasure for having me today. How are you today?
I'm fine, thank you. And you?
Not bad.
Oh, good. So the conversation, we've had this over and over again. Yeah. For instance, I was happy when Dr. Ali Pate was made the Minister of Health. And I felt perhaps we're going to have a different direction to addressing the issue of this doctor-patient ratio. But there hasn't been many significant movement in that regard. But first, I'd like to get your thoughts to what exactly led to this point in our medical system or sector.
Okay, thank you very much, Joshua, for bringing this to the fore. And I bring greetings to you from the president of NMA, Professor Bala Odu. One of the things that has happened is that we're not true to ourselves in this country. We have shifted the value for our rights, because one of the things about our right is right to health. We are focused on magnifying what are not important than things that are very, very important. We have seen that we've lost value for love. I tell people, I say, if the government loves the people, the basic tenet of life will be provided. For example, we have very, very far cadres of the very rich in this country and the very, very poor. There's no middle class at all.
Not anymore.
Not anymore. You know, so there's no value we are giving to the people. Doctors, health professionals do their job passionately. You know, you train in medical school, you train in university, you go through a lot of rigors, you know, pass exams and everything. The basic thing you should do when you finish school is to be able to give yourself at least a good life. That the stress you went through medical school, you can replicate it and be happy. But that's not the case here in this country. I think what has happened is that we have not done budgeting properly as a nation. Healthcare budget has been very, very miniature in the last few years. You know, we are focused on defense, on security, on humanitarian, on things like library, buying books in places. You know, we have not focused on those very important values, health and education. So if we had increased the budgeting, we have put into cognizance that healthcare is not a capital expenditure. It's a social impact. You have to create that venue that says we believe that Nigerians should be safe, should be secure, should be healthy. This is our reason for this. When I saw that the health ministry was expanded to social welfare, I was happy. I thought it was a point of saying, okay, social welfare, our very elderly people, the orphans, you know, the under fives, we'll create a budget for them and take care of those people. That's like social welfare. In America, in America, in other climes, they have social welfare that, if you're elderly, there's a money you take every month for healthcare. You go to NHS for free health services. So I thought that was the plan. So the figure of that will help us adjudicate what value we are giving to our elderly and our under 5.
Okay, Benjamin, I do agree with you that our government is paying lip service to the health sector, and we have done this year in, year out. But essentially, what are the factors responsible for this JAPA syndrome? Is it welfare? Is it motivation? Is it the lack of equipment to function? And what essentially are the factors responsible for these huge JAPA syndrome that we barely have sufficient medical doctors in the country as we speak? According to your president now, Bala Audu, he granted an interview recently.
Yes.
And he was referring to a data from the Medical and Dental Consultants Association of Nigeria, which showed that about 1,056 consultants left the country to seek greener pastures between 2019 and 2023.
Correct.
Then the NMA itself also revealed that over 900 of its members left for Europe between January and September 2023.
Correct. So now the normal WHO rule says is 1 doctor to 600 patients. Now we have 1 doctor in Nigeria to 10,000 patients, even more.
God.
So there is a lot of burden on the doctors. They are dying. They are having morbidity. They are getting very sick. Those that are very sick are getting worse because there's overburden on them. Now, why would you not want to leave a place that doesn't appreciate what you're doing and go to a place that is very, 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 very sane? Your children can go to a proper school. You have welfare sorted. Everything you need to do is available for you for equipment. For example, you want to use, you need gloves. They're not available in some particular facility.
Something as minute as that.
I tell you. So you go to the primary health care. So for me, we have to start from the baseline. We have 774 local governments in this country. The first access to health care is the primary health care centers, which means every local government should have a functional, doable, well advertised working PHCs. But we don't equipped, but we don't have that. Even in Lagos, we don't have that. So people now have to now go extra mile and look for how to get their healthcare sorted. What has caused this JAPA is very simple: lack of motivation, lack of adequate remuneration, lack of welfare packages. I remember when our older colleagues left medical school. As I finished medical school, you have a flat given to you and a brand new B2. Back in the days, or 504 Pojo, back in the days. So that encouraged them to stay back and see we are patriotic, we are giving back to the country that has sorted us out. But now, if you finish medical school, you finish this, there's even no place to get you employed. Doctors have done primaries for residencies for a long time. There's no opportunity for them to get employed because people are not saying the truth to the government. As I said, it's lip service. We come out every year and say, we want to do this. But one of the things I am happy about, looks as if we're thinking rightly, is the idea that they've said that they want to expand the intake of medical students.
Yeah.
But 2 things. Do you just expand medical students intake? Who are the ones that will train the medical students? Are you thinking about their welfare? Are you thinking about their own also continuous training? It's very, very important because you don't just say expand medical students from 200 to 400. Who trains them? What is the additional value you're giving to the welfare package you're giving to them? Let me tell you something, Joshua. Have you heard about many doctors being abducted, going to work in the morning, being killed? There's a doctor now in Kaduna that has been abducted by bandits for the last 3 months. Nothing has happened to the doctor. So how do you feel other doctors to feel? Do they feel safe serving the country? No.
Is it all stories of woes? We still have somebody like Benjamin here in Nigeria. We still have the president of NMA. We still have some doctors in our hospitals. Is it all that bad?
So some of us are very, very enthusiastic that we're not waiting for the light at the end of the tunnel. We're being light through the tunnel. Because if all of us leave, who gives the direction, who gives the joy, the enthusiasm to younger doctors coming up. For me, personally, I can't leave this country because I believe I have a role to play to fix it, personally. And if all of us leave, who will do the work? Yesterday there was a new policy. I'm sure you saw it about that was signed by the president that talks about women resources of healthcare. I hope this is a true reflection of what we need to do now to retain our doctors in this country.
Okay, let me just play the devil's advocate for just a few seconds. Now, for you to go abroad to study medicine, you're going to cough out a fortune. In Nigeria, we train you medically just for pittance, as well compared to your other colleagues. We also know about the resilience of our doctors, no matter the kind of training they get here. In as much as they're certified and they've written their old certifications abroad, they begin to function effectively well. So you have a situations where foreign countries are like niches, poaching on our doctors, even though they'll say we have bad education system, we don't have the best of equipment, but you don't have any problem whatsoever
taking our people.
Taking our people. So how do you marry the fact that, and remember, at one time, the federal government was even thinking like, before you leave the country,
you have to sign a bond.
You have to sign a particular thing. Don't you think that the thought behind that is justified?
So I don't think it's justified.
Why?
I think there is the freedom of movement. But what I would say to you, Josh, is this, and I've said in very many fora. WHO gave some countries red alert and says these countries you can't go there and take doctors. About maybe 3 years ago, it was a big story. UK, US, and I told them, why are you taking doctors from these places that have red alerts? As I said,
is Nigeria on the list?
Yes, on the list. So I have advised that if our government will take things very seriously, it's not the doctor that should pay a bond. If UK wants to take 1,000 doctors in Nigeria, they should pay for the training to the Nigerian government.
You tax them.
Yes. UK should say, okay, if you want to take 10 doctors to Nigeria, you must pay us for the training the doctor. You must pay us for the doctors' powerful and intelligent resources. Because if we say we're not good, why are we the best in the world? Yes. We're the best in the world. You know, in America and the UK, the best doctors are Nigerians. Yes, I can beat my chest to that. But you can't now begin to put the burden on the doctors that have gone through stress, mental exhaustion. Some have failed before and rose up again. Some have been on strike and spent 10 years for a 6-year course. You can't say it's upon them to pay. No. The government that is poaching them should pay for that. I remember during COVID that UK brought in a flight that was going to lift 120 medical doctors. It took us, with the Commissioner of Health of Lagos, to stop that. That you can't do that. We're in the midst of crisis. We've lost doctors in the face of challenges. We've lost healthcare professionals. Why are you coming at this kind of time to take people? No, we said no, you can't take them now. So government should be serious about it. And I know the Ministry of Health is working on that, especially our renowned Professor Ali Pate. You must, if you're going to get our doctors in Nigeria, you as a nation must pay us as a nation for taking our doctors.
Will doctors be comfortable with that? Because they will tell you, like, excuse me, I paid for my medical school.
Let me explain to you. You're very correct. What it costs us to train a doctor in Nigeria is far less than what it costs us to take doctors there. And if you have poached us, that extra cost of training us, you should pay for it.
Benjamin, okay, what are the dangers ahead of, if this situation rather should continue like this, what are the dangers ahead in terms of the pressure that our doctors are going through, a doctor to about 10,000 patients, and the shortage of these doctors, is it only peculiar to Nigeria alone? Because if the United Kingdom now, if they have enough doctors, they will not come to Nigeria and, of course, be poaching our doctors.
Okay, so in the UK, because of economy, very few people in UK go and study medicine. They go to tech, fintech, you know. So they're not even yesterday. I heard about their prime minister begging the teens to choose choose medicine. was begging them, please choose medicine, please, because the tenacity to be a doctor is not small, my friend. It's not small. And if you're not patient, if you're not diligent, if you're not very compassionate, you can't be a medical doctor. And that's not the culture they have in those clients.
And if you're not brilliant.
If you're not brilliant and intelligent. So for me, is how do we stem these challenges? Government must be truthful to their words.
In terms of what?
Let me explain to you. We've had commerce salary that was already signed to law in January. Some institution has not gotten their arrears till now. That's not being truthful.
Okay.
If you say, I'm going to pay you this salary, just pay it. There are hospitals that don't have equipment to do the trainings they've gone for. Make it available.
So
let them enjoy. So it's about making the environment enabling.
Why can't you call them out? Why can't you call out some of these?
This is the point, my brother. Everybody wants to save a face or save their job, because most times the CEOs are politically driven. So
your appointment.
The appointment. So they are answerable to some people or powers that be. But the truth of the matter is that if you have love for the people you are serving, if you have love for the doctors that are dying, if you have love for that doctor that has been taken into captivity for 3 months, if you have doctors that have been maimed, there was a major doctor that was training in Anambra that was maimed in the night going for emergency. Was maimed. Nobody, no government even said a word about it and said, we are sorry for failing you doctors in this country. So yes, that's failure.
How do we move from the era
the point is, my brother, the point is this, I'm very passionate about this. Government should be truthful to their words. Number 2, be sincere. If you cannot do this, say you cannot do it. But when you give your order, you're going to do it, make it happen. Try to make it happen.
They are always scared now because you go on strike every time.
We've not gone on strike since.
Okay.
Go ahead.
Okay,
because for us.
But you kept warning.
This new ESCO believes there are better way to engage than strike.
Okay.
So we do a lot of underground work, a lot of back end work, dialogues. You know, speaking the truth, having a better way forward on how things should be done. You know, for example, now my president was telling me that if in the university you have what we call excess workload allowance. But we don't have that as medical doctors. But we work more excess than anybody in this country. So those are the things we are talking about, putting into the allowances. If you work in rural communities, you should have a rural community allowance, so it can make you stay there. So we don't have 2 japa. There are 2 japas now. Japa from rural to urban, from urban now to what? Abroad.
Okay.
So the funnel is very large. Large from the rural areas, they're coming to Lagos. They do 3-4 months, they're out of here.
So even within, we are fighting a war.
Yes.
Okay, so how do we move away from that era of just building? Because we see a lot of buildings being commissioned. Oh, we have built this particular hospital. But when you go inside, it is virtually empty. So my question now is, if I'm a broadcaster, you do not, I do not have a microphone, how do I project? How do I speak? So as a medical...
your voice.
So how do we move away from that era of just building to facilities and equipment?
First things first is that we must increase our budget allocation for healthcare. And we must be conscious about it and accountable. Accountability is one of the major things in this country. We give our budgets, we give our project, nobody is accountable. Who answers to anybody? You say, I want to build this. You give me money for that. This building will cost 13 billion. And we give you an MRI, we give you a CT scan, we give you this. But when it is done, who goes to supervise that these things that are better for are available there? Nobody does. So we do wishy-washy. And see the outside, the fine building, excellent building, but the inside, we're not detailed enough to be accountable. When you put a CEO in a teaching hospital, who is he accountable to? Is it the powers that be? Or those that are responsible for the institution? For me first, let's be true to ourselves. Equipment is important because it makes the work enabling. There are fantastic doctors in this country, amazing doctors that have gone for training, even gone for training personally to improve their capacity. But the instruments they need to work are not available. And when they ask you questions, when they ask the CEO questions, they are shut down or they are said, don't you know the system? So it's like a system thing. You say as if the things are working because you want to appeal to people, but they're actually not working. So accountability is key. So this is what I say to people. It's about output and outcome. If you say you have 7 urologists in your hospital, it means the urologist must do maybe average of 20 cases a month. And that 20 cases gives you the income of that month. And so, okay, for this urologist, we made social amount of money. If we lose 10 of them, we will not make social amount of money. So the internally generated revenue will drop. So if you now make our work according to our inputs, then we start solving problems. Most times you want to do this, you want to do a procedure, the equipment you need to do is not available, so the doctors have to now buy those equipment for themselves to solve the patient's problem. It doesn't work that way in this country. It shouldn't happen. It shouldn't happen, my brother.
Because I noticed that there's a lacuna here. The promises from government, the ability to say, look, we'll deal with this thing, is a social contract, especially when it comes to those primary things, food security, shelter, but of course the health of the people, which is also part of a social enterprise or social contract between government and the people. So the question is, because you talked about government has left what is important to address other things they feel is more important. You talked about security. And for them, they feel that is what we should deal with now.
But the doctor is in captivity.
In the face
3 months.
In the face of inflation, in the face of scarce resources, in the face of demands from all sectors.
Yes.
You can't bring anybody here now, if it's engineers or even tailors or fashion designers. All of them will tell you how much they need attention.
Engineers will not work if their health is very dilapidated. Let me explain a few things.
Let me finish my question,
okay,
then you can now respond to this. So how do you want government to address this in the face of, don't forget, other competing demands
and scarce resources? I like that word, scarce resources.
Yes.
One of my greatest joy this period is that local government has an autonomy now, which means the direct focus on primary health care is local government. But who are they now answerable to? That's the first question. So local government chairman has a lot of money now to them from their IGR, from the federal education, whatever. But now, who are they answerable to? So are they answerable to the governor or to the president? So now they'll now form their own cabal, and nobody can now ask them questions. If the local government chairman now would now say, okay, all the primary health care in my state, under my institution, I want to make it work, and I will use it. You know what happens about use is when a leader uses a facility, it creates a followership that I believe in that facility. Not when you have a headache or you have ear pain, you are out of the country spending taxpayers' money for healthcare abroad. So if you're going to fix the country, why don't you spend your money, your riches in the same country? So if local government will focus on primary health care clearly, and let us know who they are answerable to, then we'll start talking. Number 2, even in the scarce resources, is how well are we accountable in the scarce resources? That's my problem.
I mean, from the one given to health,
yes,
or from
health, or everywhere. We are focused a lot in this country on oil, and you can see all the paraphernalia, all the issue about oil, refinery this, refinery that happened in this country. Agriculture, we have neglected. I remember back in the days, you remember the cocoa plantation issues that gave Western Nigeria a lot of money. What happened to them?
Okay.
That is, we have passed that level now.
Okay. Josh.
Benjamin.
Yes, please.
My fear now is this. Okay, people like you, you love this country.
Yes.
You don't want to
Go. I will not
you don't
japa.
want to go. You want things to change.
Yes.
But the new generation or the new set of doctors that we're training,
They're not waiting. That's why we're staying. The reason why we have started to stay, because we're not far from them. We're not very old. So we're trying to call them.
is that not a signal that there will be trouble in the future?
So medicine might go to extinction. I tell you the truth. Because the only thing that will make doctors see the future is when they can see a senior colleague that looks like what they want to be like. You see a senior colleague that just bought a fairly used car and is doing a party at 65. They're telling you, Organo, a banker just 25 just bought a new car the day before yesterday, brand new car. And tells Organo, I don't want to be like this. Oh. There are doctors that have finished medical school, gave their father their certificate and said, Daddy, sorry, this is for you. I'm going to take.
I'm going to think that, yeah.
So we need to create an enabling environment. Why can't government give doctors 1-digit loan in their hospitals and say, okay, come and take this 10 million to support your businesses, your hospitals. Give us at 1 minute at
Okay.
1 digit.
Benjamin, please, you have to hold your thoughts a bit. I'm aware that we need to take a very quick commercial break at this moment on the program. We'll be right back.